Welcome to the UK Hair Transplant Clinics. What we're going to do today is answer how many grafts do I need? Many people get confused as some clinics call them grafts and others follicles. But don't worry, they're exactly the same thing. So let me introduce myself. My name is Paul Hill. I'm from the UK Hair Transplant Clinic and I'm a qualified surgical assistant and accredited and trained to perform hair transplant assessments and assist with the surgery. I'm regulated by the ISHRS, which is our International Society of Hair Restoration Surgery, the professional association for the restoration profession, and here's my qualification. Having had a hair transplant, I can fully understand how patients who have lost or losing hair feel and how difficult it is to talk to somebody about it. So this is my pictures of myself. I had a hair transplant surgery around about 4 years ago. And I needed a total of 5,500 follicles, so I was actually classified as a Norwood 7. Now ordinarily you can have that number of grafts over 2 treatments. However, in my circumstances I could only actually find around about 1,700 follicles in turn that were actually of good quality, which would mean that they would be implanted successfully and successfully grow. So therefore, I was never going to be able to have a full treatment. So this is where it's important when we see patients, we talk about expectations. Happy patient is, if their expectation is here, we have to ensure that we can get either to that expectation or as close as possible, which is acceptable. If the patient wants to be here, and by that he picks out a picture of when he was 18 and brings it to the consultation, which sometimes they do, and the patient is in their late 40s, and say, can I look like this? The answer would be, unfortunately we can't do magic. So if we believe we can't ascertain to that level, then it really, the patient's expectations mean that it's unrealistic for us to do a transplant on him because he would never be happy. So having managed my own expectations, having 1,1600 as opposed to the 5,500 that I needed, we chose to concentrate on using them wisely to give us the impression. So we concentrated a lot of follicles around the forelock area because this is the area that you see in the mirror, and this is the area where in terms of you're going to feel good. And then we've put a few around this area here. The bottom line is, am I happier now than when I was pre-surgery? And the answer is yes. I feel a lot more confident. I feel, invigorated. I feel like it really changed the way I felt. Okay, it changes the way that you look, but that's not the most important thing. It's most important is how you feel. So I can talk to you exactly from where a patient perspective is. Okay, so what is a graft? What we have on screen here are 1 hair follicle, 2 hair follicles, and 3 hair follicles. You can see this bit here, the tissue would actually be below the skin, and you can actually just see hairs coming through. So the average follicle produces 2 hairs. So what does this actually look like in real life? So this is the healthy donor area. So for example, where I have the cursor here, you have a 3 hair follicle going across, slightly weaker. You have a 2 hair follicle. And here you have a 1 hair follicle. So these are the follicles that we're going to take, these healthy follicles from the donor area, and implant them into the recipient site. So, how many grafts do I need? The answer is key to not only calculating the price, but to one of the main secrets to having an unhappy patient. So what do I actually mean? So take this patient here. This patient came to see me in clinic about 2 weeks ago. When I started talking to him about grafts and follicles, Clinic 1, where he'd been to see, told him he needed about 2,500 follicles. Clinic 2 said he needed 3,500 follicles. And I said he needed around about 5,500 follicles. So how could this be? Are we both looking, or were we all looking at the same patient? The answer is yes. So I asked the patient how the first 2 clinics came up with a number, and he said to me, they just looked at me and said 2,500 and 3,000 follicles. So, how did I really get to my conclusion? The answer is we actually use a formula, and the formula is quite a couple of variables that are on there. The first variable is how many is the size of area. So we had in this patient here, we had the forelock, which is the front area. We had the mid-scalp, and we had the crown area. The patient in the forelock in the front needed 1,500 follicles. In the mid-scalp he needed 1,900 follicles, and in the crown area he needed 2,000 follicles. So what would have happened if the patient would have gone to clinic 1 and 2? Well, they would have implanted the follicles, and if the follicles all grew, that patient would still have been very unhappy when he came back at 12 months, because the level of density would have been poor. So the number of grafts required depends on, number 1, physical size of the area to be treated. Number 2, assessing the planned treatment area for existing density and quality of hair. 3, looking at the quality of the donor area, i.e. how many hairs per follicle, thickness of hairs, colour of hairs. And based on this we calculate how many follicles per square centimetre is required to be implanted. So the formula calculating the number of grafts required is simply the physical space in square centimetres multiplied by the number of follicles per square centimetre. So let's calculate in real life. So what we have to do to start off with working out the calculation number of follicles is work out the space. So how do we work out the space? We discuss with the patient what he's looking for in terms of the shape of the hairline in this instance, and we've started and we've calculated that 7 centimetres from the eyebrow is the average normal area for the hairline. So with this patient here, we're now going to then draw a hairline. Drawing a hairline so that it's a natural hairline, I discussed with him earlier how his hair used to be, so we didn't want to make it too flat at the front because he's never had it flat. Okay, then from that I'm now going to mark up different zones. The reason why we do this is we place different levels of density in different zones, so I need to find out the different size of space in each of the different zones. So I have the forelock with this patient. I'm looking at the crown area, which is at the back. I'm marking up my dimensions there, and then I'm looking at the mid-scalp, which we normally take on the apex of the crown for the mid-scalp, and we're going to have a different level of density there. So now we've marked up the different individual treatable zones, and now what I'm going to do is take the physical measurement of that, and I'm going to do that by scanning in that shape into my computer so that the software we can use to calculate how many square centimetres accurately are within there. And one from the front to complete that. Excellent. So now what I've got is an accurate measurement of the whole treatable area in terms of square centimetres. So the next question is, what do I need to implant? Whilst the density of hair at the back in the donor area varies from 80 to 100 grafts per centimetre, to achieve the illusion of full hair we require to implant between 30 to 45 grafts per square centimetre. This all depends on the quality of the person's hair, i.e. is it fine, its colour, the ratio of hairs to graft. The reasons why we don't implant more than this are, number 1, the human eye is not a microscope. It doesn't normally recognise any difference between 40 to 100 graft density. Number 2, if you try and implant more than this, the blood supply and nutrients required to establish the follicle would be spread too thin, and a lot of them wouldn't survive. Another reason is 3, because they're implanting close to what we have just implanted, we could damage some of the new grafts. So here are a few more examples of patients' templates with levels of density. Okay, let's take this patient here. This patient was wanting to increase his density around the front area and also increase his density in the crown. So let's take the front first. The measurements as we previously scanned in. What we had was the hairline area, which was 38 centimetres, and we implanted 35 follicles per square centimetre, that gave us 1300. And he had a very strong area here, so we didn't need to implant into this area, and we just had to bridge this gap here, which was 10 centimetres by 20. So the whole of the front area here would be around about 1500 follicles. The other area at the back is his second priority, the crown area, and here we had 60 centimetres of space, and we were implanting 30 follicles per square centimetre, which would mean he would need around 1800. So in total, this patient for two areas, the front and the crown, was 3300. Take this patient here who came to clinic. This was his crown that was concerning him. So when we measured the area, we came up with 60 centimetres of space, and we planned to implant on 35 follicles per square centimetre, which means it would be 2,100 follicles needed for this area. And this patient here is another patient I saw quite recently. This patient was mainly concerned about his forelock. You can see that we segmented the area into extending the hairline and also the area of filling in the forelock. On the hairline, across both areas, we had 33 centimetres of space, and we planned to implant 40 follicles per square centimetre. And in the front area here, we had 25 centimetres of space, and we intended to implant 35 follicles. So in total, to build this area up here, we were looking at 2,200 follicles. Okay, so to conclude, hope you found this short presentation useful and understand the importance and accuracy of calculating the required number of grafts. You can have the best surgical team in the world that perform amazing surgery with all the grafts growing, but if the treatment plan is flawed from the outset, then the patients will not get the results that they want. If a treatment plan is guessed, there are simply three outcomes. They underestimate, and the number of follicles is thin. They overguess, which means that you're paying for follicles you don't actually need. And the third, they actually guess right. It's recommended having a consultation with doctors or surgical assistants who are qualified and trained and experienced in treatment planning and have been assessed by the HRS as being competent in this area. Always check the person you are having your consultation with is a member of the ISHRS. For more information or to book a free consultation where I can see you and I can assess the number of follicles you need, as well as giving you the price and talking about suitability, please contact us on 0800 043 0993, or simply go to our website www.ukhairtransplantclinics.co.uk. Thank you. See you soon.